Hello again and welcome to this segment. In this particular segment, we're going to talk about treatment services for women. We know that usually treatment services were modeled after services for men. So here we're going to talk about today with Gabriela Perez. She is the program director for the Mujeres Sanas en la Frontera program, and she's going to talk about treatment services that are designed specifically for women. Can you tell us a little bit about why we have the need of designing services specifically for women?
Yes, yeah. Thank you, Luis. I think it's very important that we have a program specially designed for women. I think women have special needs and circumstances that we need to, acknowledge and make sure that we provide services for circumstances that they experience uniquely. One of the things that we look at for women is that many times they have experienced difficult situations, difficult events in their lives, and we want to make sure that we address those events and understand that they may have experienced and how those may have impacted their substance use.
Can you talk a little bit about what are those typical adverse experiences that women go through?
Yes, many of the times they have gone through sexual abuse, sexual assault, or they may have gone through some emotional or physical violence, and many other different traumatic events. And we know that the impact of those events, of course, may have a lot of impact in their emotional distress, and many of the times it can lead to substance use.
So all this negative experience kind of related to trauma may in a way impact the way they feel, but also their need to use substances.
Exactly. So many of the times going through these very difficult emotions or situations can lead to cope through the use of substances.
And then also women, I'm imagining, because of usually in our society, they're the primary caregivers, they face additional challenges.
Exactly. Many of the times I think women, we have to juggle between, the caregiving, attending our children, taking care of our children, and also maybe holding a job or even taking care of ourselves. I know that for women, sometimes we culturally we're expected to really, take care of others, and many of the times we don't take care of ourselves. And so part of our program, we really are always looking at when women's health and self-care is very important to us.
I see. Yeah, I can imagine that because there's roles that a society has assigned, that if they, for some reason, are not doing a good job because of the substance use and mental health needs with their children, that may increase tremendous guilt that it may in turn lead them to use more substances.
Absolutely. And I think one of the things that we definitely understand about women and how difficult it can be, even the shame that may be involved for them, and even asking for help can be difficult. So definitely we want to we acknowledge that and make sure that we provide services that address all those situations.
Right. So then tell me a little bit about the services that you provide, and if you can discuss a little bit about what happens in outpatient, and if you can, the links also to more intensive services.
Yes, usually, we any women can come and call us. We do a first interview. We look at their substance use, and from there we determine, what are best services for that particular woman. And we here in our outpatient program, we're able to provide individual counseling, substance use, a group counseling as well, and we're also refer for any additional services. Sometimes they may have some emotional situations going on, so we refer for any mental health situation. And also we provide HIV and hepatitis screenings and link them to care as needed.
Well. So you do the testing, the counseling, and the linking to care.
Exactly.
And you talked about not only that you provide the services that you mentioned, but also that you look at other needs that they may have and link them to the community.
Exactly.
And I understand that if they have a co-occurring psychiatric disorder, that you provide additional services. Is that correct?
Yes, actually, we link them to. We have a program here that provides services for with case management services to make sure that they are linked to mental health services and they continue getting those services. So definitely, we provide that support.
Okay. So just kind of going again, so do you provide screening, assessment, HIV testing and TB testing, access to care, case management services, parenting?
Correct. If the woman has children, we also provide parenting sessions, so that way that may be an area that they can determine what area they would like to improve in their parenting, and we provide those parenting education sessions.
What about reproductive health?
We also provide reproductive health because, as I was mentioning, many of the times, women do not take care of themselves. So we want to make sure that they are, attending their medical needs or anything that they may be lacking, and we provide education on their health and reproductive.
Because they may not have that information. They may not be literate in that respect. So you have kind of helped them understand better their health needs.
Yes.
So you mentioned earlier that women many times are victims of sexual assault. Maybe as children they experience sexual abuse or physical abuse, a lot of different traumatic events. Tell me a little bit about how you address these issues in treatment.
Yes, we have evidence-based treatment curriculums that we implement here at our program. We use a particular curriculum that's called Seeking Safety, which is an integrated trauma and substance use treatment. So we certainly look at trauma, and also what we also do is we also have another program here that if the person has had sexual assault, we link them to additional individual counseling that addresses any specific issues that are related to their sexual assault or sexual abuse that they may have experienced. But all our treatment integrates trauma treatment. And we do look at the impact of how trauma is currently in their lives, what is the impact that is currently, and we focus on developing coping skills so that they can address and be able to work through those emotional situations that they may have gone through and are going through.
And I can imagine that is very important, because if you treat the substance use but you don't treat the trauma, then that may lead them back to substance use because we haven't dealt with traumatic reminder.
Exactly. So that's really very important that women are more aware of how the trauma has impacted their substance use and their lives, and what are ways that they are able to develop these additional coping skills so that they can work through those situations.
Yeah. So I heard also that you kind of infusing mindfulness into this project. Do you mind talking a little bit about that?
Yes, we are also implementing what we call ACT, which is Acceptance and Commitment Therapy, which uses some mindfulness and many different wonderful strategies to really help women live the present moment, be more aware, look at how their emotions and what are different values that are important to them, and how can they really move forward on what's important to them. So these are really additional wonderful strategies that we're implementing that we are finding that are very, very helpful for women to be able to better live in the moment, in the present, and appreciate many of the wonderful things that are accessible to them. And that sometimes with your substance use, it really can overwhelm in such a way where, women can lose sight of these wonderful things.
Yeah. And I think I'm glad that you mentioned that, because I think human beings have a tendency to go back to things that they cannot change and live there, or be worrying about things that may happen in the future and be there, but not necessarily focus on what is going on at the moment. And I'm understanding that that's part of what the program does, helping people really focus more on the moment.
Exactly, and what they can do now and appreciate many of the things that they have access to, and they themselves, develop what is something that they want to do now that's going to be important to them.
Excellent.
So, yes.
Sounds like a great program, and I appreciate that you came, to help me to get interviewed for this segment, rather. And are there any additional things that you would like to say, women who may be watching this segment?
Yes, I really want to invite women to not be afraid to call us, to that everything is confidential, and to have the assurance that it is a safe place for them to come and talk to us, that we don't force anybody to go in any direction that they don't want to, and that we're going to offer the services that we may feel that they may need, but they always have a right to say, this is not something, or I'm going to go, maybe we may recommend a residential or medication-assisted treatment, which is also something very important that we want women to have access to, but they are the ones that can choose that, and that we always are going to respect that, and that they rest assured that everything is confidential.
Great. Well, thank you so much. So anybody who's watching, please call. Our number or the information is on our website, and we'll be happy to respond to you right away. Remember that all the services that SCAN provides are free of charge. So thanks again.